Folks, and welcome to Kaizen Institute's Guidance on Preparing Workplaces for COVID-19 webinar. I'm your host, Chuck Cherry, and it's my pleasure to introduce this webinar that's sponsored today by our partner, Promega. It's also my pleasure to introduce Mike Mickelwright, who is our Kaizen Director of Operations for the United States. And Mike has over 30 years of experience in leadership of Kaizen, Lean, and quality groups. Our webinar agenda includes a question and answer period following Mike's presentation. So if you'd be so kind as to leave your microphones on mute until the start of that question and answer period, we'd appreciate it. Should you want to bring up something during the presentation, if you mouse over the middle of your screen, you should see a toolbar pop up. One of those says show conversation. If you press that, you will get a conversation chat box that pops up on your screen on the right hand side, and you'll be able to type in a question or a comment. And if you do that during the presentation, I will find an appropriate time to bring it up with Mike. I hope you enjoy it, and with no further ado, I will send it over to Mike. Take it away, Mike.
Thank you very much, Chuck. Hello, everyone. Again, as Chuck said, my name is Mike Mickelwright. I welcome you to this webinar on guidance on preparing workplaces for COVID-19. I know we have people calling in from all over North America, and we have some other partners and clients and acquaintances that are also calling in from overseas. Welcome to all of you. I'm personally calling in from sunny but cold Chicago, Illinois. So I thank you for joining us, and a little bit about the title first, just so you have an idea, conceptual idea of what we'll be covering. This is an OSHA document that was just published in March, so they're very speedy about getting this out quickly. Of course, as we all know, that this is extremely important to get out, and so they worked on it rapidly. And so my intent is to provide the information and the guidance behind the document that they prepared, but also to do so with a Kaizen mindset. So I know that many of you, since you're affiliated somehow with the Kaizen Institute, you know about Kaizen. And Kaizen, for those of you who don't, quite literally means to break apart to make better. So the idea is that we want to break apart processes, to study them, to analyze the current state, to look at the details, and then make them better by driving out waste. Well, the first part of Kaizen has kind of been done for us, you might say, the break apart. So a lot of our processes have been somewhat broken by the COVID-19 virus. And but that means that there's all the more reason now for us to make it better, to go ahead and make it better. I find it interesting sometimes with a number of clients and acquaintances that I have, perhaps they were working on Kaizen projects, or they were going through an entire transformation, a Kaizen transformation. And the concern is, oh, shoot, we're going to lose our momentum. We were doing so well. And now with all of the things that are going on, this could set us back months. And of course, they understand that this is so important and it has to be that way. But priorities change, and they certainly have changed now. But I want to also issue a challenge to anyone out there who has any background with Kaizen, with Lean, whatever you want to call it, continuous improvement, or even some of the quality aspects. This is the time to step up. This is the time to use all of our knowledge and our skills and the principles of Kaizen to make the deployment of standards, of requirements, of the workplaces, to make them safer, to use everything that we know and use it in this capacity, in our capacity, to make the workplaces safer and to protect all of our employees. It's very applicable. So this presentation, this webinar, is about looking at the standard or the guidance document on the one hand, and then sorry about that. Okay, so to look at it on the one hand, the standard, the requirements on the one hand, but then to look at the Kaizen requirements and to see how we can use them to make for an effective deployment of the requirements of the OSHA standards. So that's the focus. That's what we want to do. But before we get into the details, I'd like to thank our sponsor. Our sponsor is Promega. Promega is an organization that I have worked with in the past, a very outstanding organization, and they're a leader in providing innovative solutions and technical support to the life sciences industry, including reagents and instruments used in COVID-19 testing. So they're in the front lines. Since January of this year, Promega has provided enough amplification reagents and enzymes to enable testing of an additional 25 million samples. Their production, the increase in production that they've had to go through in the past several months is just outstanding. It's unbelievable, but they've had to do this, and they're there to help us, and they can teach us some things. So we're really thankful that Promega is sponsoring this webinar, and they've also provided me with some slides and some examples of what they've done to deploy the guidance requirements by OSHA. In the past, Promega has been quite involved in value stream mapping and doing some transformations within their facility. One such project was a water spider project. Some of you may know it as the Mizusumashi process, but a water spider is the English translation of Mizusumashi. And this project had to do with the logistics and kit packaging teams, in which, because they deployed the water spider, their process efficiency gained by 28%. Now, why is that important? Well, one of the biggest focus areas, what was so important to Promega at this time, was that they really wanted to develop their processes so that they were scalable, so that as they grew with time, that it would be easy to transform the process and to build the process without too much headache. Now, I don't think anyone could have anticipated the need for scalability in their business when capacity had to be increased by 3 times. But because of the work that they had prior done during these events, scalability became much easier, and they stuck to the standards, and they were able to produce the reagents required for the testing. So once again, thank you, Promega. And by the way, this webinar should run during our rehearsals. It ran roughly about 55 minutes. And then we were going to allow for Q&A sessions, and we still will, of course. But some
Mike, if you're still on there, you've frozen.
Yeah.
Just bear with us, folks, while we deal with this technical matter. I'm sure Mike will be back with us soon.
Chuck, are we all good here?
Yep, you're back.
Okay, I apologize. Don't know what happened. Just completely went fritzed out there. So thank you, Promega, for all that you've done. Now, with regard to
Mike,
yes.
You don't have the PowerPoint shared.
Okay, just hold on, folks. How are we doing now?
You got it there. Thank you.
Right. Sorry about that, folks. So we will go through the introduction. So the introduction to the standard, or the introduction to the webinar itself. First of all, number one, this is a guidance standard. It's advisory in nature, and it's informational in content only. It's not a standard. It's not a regulation. As such, there are no legal obligations. There are no shalls. In fact, there's encouraging words throughout this document because it is a guidance document. It's not full of shalls, and it's not auditable. The complete guidance document you can find through this link, and this entire session is being recorded. So if you wish to have this this session, the recording of this session, you may get this, and then you will also have the link to the document, or you can of course just do a Google search for the OSHA 3990 guidance document. So what we are doing is in this webinar is providing a service for summarizing the document for your awareness and for your ease of understanding. So we're kind of making it simple to understand with examples, but also with some awareness of what can be done internally with those examples. Any opinions that I express, and I'll try not to express too many, I'll give you what I know or examples that I've seen from clients. But these are only opinions, and I also ask you to refer to the OSHA 3990 document if you want some additional concrete answers. So additionally, as I mentioned at the forefront, is that what we are trying to do is to identify how the tools of Kaizen can be used to ensure effective implementation and deployment of the guidance requirements in this critical world today. So the webinar will not review such things as the origin of COVID-19, the symptoms, how the virus spreads, or how the virus can affect any of the workplaces. We're not going into that. You have plenty of resources. You see it on the news all the time. There's constant updates, and it also is in the OSHA document if you'd like to do that. We're going to primarily be looking at the guidance, just the guidance, and how to plan and implement for different types of controls. And in order of priority, those different types of controls include engineering types of controls, administrative, safe work practices, and of course, PPE, personal protective equipment. Now, what does OSHA do for us? Well, OSHA 3990 provides us with the structure. It kind of tells you this is what you should do. This is what is really important for your organization to address. And there's many different elements to it. Well, that's great. And that's what we need to know at a minimum. But then how do you do it? How do you do it effectively? And that's where Kaizen comes in. The Kaizen methodologies and the principles and tools is going to provide the value. They provide the how. And so we want to merge those two together. We want to bring those two together so that we have one system. And so, as I said at the forefront of this webinar, is you have the OSHA 3990 guidance requirements, but how to deploy them effectively? Use the Kaizen mindset. Use the Kaizen principles and tools. Everything that we've learned, point of view storage, 5S, Kanban systems, et cetera, et cetera. That's what becomes important. So at the forefront, before I get into the actual guidance document, what I want to do is to briefly go through, for those of you who do not have a background in Kaizen or in Lean, for those of you who do not have this background, just go through a very quick one-page overview on all of these tools and concepts that could be used to effectively deploy the guidance requirements in OSHA 3990. This includes such things as 5S and point of view storage, one-point lessons and other standard work, Kamishibai tasks and audits. Again, we'll have a one-page quick explanation on all of these. Poka Yoke, or mistake proofing your systems. Kanban and supermarkets. Mizusumashi, or the term water spider. We saw that example from Promega. Also, total productive maintenance and training within industry. These are all tools and concepts that can be used to effectively deploy OSHA 3990 requirements throughout your facility. The first tool, and again, just one page on each of these, is 5S. Many of you know the 5S's stand for sort, set in order, shine, standardize, and sustain. These are all about increasing efficiency and productivity. Some people talk about housekeeping. Sure, housekeeping is a good outcome, but the primary focus is about efficiency. So how does this apply to COVID-19? Well, sort, of course, we need to sort out the virus. We need to get the virus out of the organization, out of the building, off of our products, off of our people. So there's a sort. We should have processes in place and standards in place to sort that out. Set in order. How does that come into play? Oh, really big time. This is really important. The whole concept of point of use storage. In other words, if we need disinfecting wipes, if we need hand sanitizers or tissue or whatever it might be, they have to be at the point of use. So if there are areas where we touch things quite often, could be a printer, a copier, or a scanner, which a lot of people might touch, we need to have those wipes right there. We need to have the hand sanitizer right now. Maybe there's a keypad to touch. Maybe there's a time clock that's being used. Maybe there's common tools and equipment that's being used. Set and order becomes extremely important. In the past, we might have just put hand sanitizer anywhere it was convenient, on a table, at a doorway, but now today it has to be at frequently touched points. Shine, of course, is absolutely applicable. Shining the processes, shining the equipment, shining our computers, our laptops, the areas, the locations, the cafeteria, commonly used areas. It's very applicable. And then how we shine. What is the correct process to do so? What is the standard? How do we standardize on that so that we're all doing it consistently? And then how do we make sure that we sustain that? How do we make sure that the standards are being adhered to? Do we do an audit? Perhaps like a Kamishibai type audit. These are the types of things that we want to deploy now before we deploy them for the sake of our business, for the sake of our products and services that we're supplying. And that still is applicable. But today we also need to deploy it in other areas with regard to controlling and mitigating COVID-19 reactions. Another tool that we talk about are one-point lessons. Well, one-point lessons, a couple examples here on this slide, is just a very simple document, one-page document, lots of pictures, very few words. We want it to be very easy to see at a glance, and we want to put those at the point of use, wherever you're actually doing the action. So this becomes extremely important in the deployment of OSHA 3990 requirements. Kamishibai, okay, Kamishibai, Japanese translation, picture theater. What it means to us, well, it's a card system, generally speaking. You see a bunch of cards on the left side. They're green on one side, and you flip it over to the other side, and it's red. These are actions that should be done periodically throughout the day, according to a schedule. So someone picks up a card, and they do whatever that action says. And if they put the card back, if everything's okay, if it's not okay, they put it back with the red side facing out. Green side, if it's okay. Red side facing out if it's not okay, if there's a problem. And then there's some kind of corrective action. We can do that for cleaning surfaces, for cleaning equipment. We can also use it for audits. How do we audit? What do we audit? We can audit how we clean things. We can audit how we put on PPE. We can audit how we sneeze. All of these things are auditable, and these can be tasks that we can use. So this is a tool that we can use also for deployment of OSHA 3990. Poka Yoke, some of you know about Poka Yoke. It's a English translation, mistake proofing. In this case, it says prevents sending a defect to the next step of the process. In our application, we're talking about preventing sending the virus onto the next step of the process or onto the next person. And this becomes really important. So what can we do to make it almost impossible to prevent that virus to be spread? Physical barriers, those types of things. What can we do? So the concept of Poka Yoke fits in very nicely. Kanban systems. Kanban, English translation, card. Simple little card. Just says, hey, this card represents a product. It could represent a hand sanitizer, dispensing wipes, masks, whatever it might be. And so the whole idea behind a Kanban system is that we want to make sure that we don't run out of those items. In the past, not a big deal. Before COVID-19, if we run out a little hand sanitizer, no big deal. Today, it's imperative. It's really important. So this is where we might want to use these tools. So we have a hand sanitizer, and maybe we have 2 bottles of hand sanitizer. Okay, and the one is empty, we throw that out, but then we move the card, there's a Kanban card, to a location where someone's going to pick it up, like a water spider. Someone's going to pick it up periodically and pick up the card and say, oh, this location needs additional hand sanitizer. When I make my rounds around, again, I'm going to bring back the hand sanitizer so that they always have another one. They always have that backup. Very important, can be used. We never thought about using this stuff for PPE before, but today's world, you have to. We have to consider these things just because it will make the requirements, the deployment of the requirements that much more effective. So many of us are familiar with supermarkets. Supermarket in the real world, where we buy our food, but also in the manufacturing world or in the production world or in some office world as well, where we store items. And we make sure that we control the quantities of those items so that we don't have too much and we don't have too little and we never run out. So the Kanban, when someone receives a Kanban and says, oh, I need more hand sanitizer, they go to the supermarket, they pick out another hand sanitizer, and they return it during their next loop around to that original location. Meanwhile, the supermarket is being replenished based on min-max levels from the other side. The Mizusumashi, or the water spider. In this diagram, you can kind of see a little train, a tugger system, a train system, hauling around product. So usually we use this for products, components to make the end product, whatever that might be. Same concept here, though. It kind of operates in a metro line mode. So a person drives around or walks around the facility, and they go to certain stops or locations. And these stops in our world now, in the COVID-19 world, might be those locations where hand sanitizers are located, where dispensing wipes are located, where masks are located, where gloves are located. And they stop there to either pick up Kanban cards that says, oh, I need more, or to drop off from the previous Kanban card that they picked up. And so there's a process, a water spider process. There's no reason, and that we should be looking at developing something like this and deploying something like this so that we never run out of these critical items. Total productive maintenance is another tool, another concept under the Lean or the Kaizen umbrella that we will be talking about briefly, and specifically with regard to air filtration systems. Air filtration is going to be really important. We need to remove airborne particles from the facility as soon as possible. So we need to have good ventilation systems, and we need to be making sure that those filters are replaced when necessary. And we need to have an understanding of when that is. What is a good filter versus when is a bad filter? What is the frequency of looking at these things and training people so that we are all consistent to making sure that we remove filters when needed. So TPM, or total productive maintenance, and specifically can be used in which more people are involved in looking for these types of problems or potential problems. Training within industry is another tool that we can use. Training is going to be really important. Even simple tasks like how to properly sneeze, how to properly take off a mask, how to properly take off gloves. There are techniques and there are key steps, key points that we have to use and deploy. Training within industry was a technique that was developed during World War II. It's a very conscientious, respectful way of training people so that they learn how to do a process, and we know as teachers, as trainers, that they know it conscientiously. They know why it's important to do things a certain way. So these are all the tools, and so you'll hear me referring to these as we go now through the standard. So to the OSHA guidance requirement. The OSHA guidance requirement is mainly divided into 5 big chapters, if you will. And it kind of starts off at the big picture where we talk about planning. Disease preparedness and a response plan, the need to develop that. So we start off at the high level, a plan. Then you start looking at what's the next most important thing. How do we prevent? What are the infection prevention measures that we need to put into our workplaces? And then we start looking at, okay, well, we've got that in place, but there are going to be some times when something happens. Someone starts to feel symptoms at work. And so we need to have processes and policies in place for the prompt identification and then isolation of the sick people or the potentially sick people. We also want to look at how do we communicate to the workplace, to people about workplace flexibilities. We have policies, we have rules that we've had for years and years and years. And maybe some of those are going to have to be modified because we don't want people to come to work if they suspect or feel that they are even the least bit sick. So some of our policies may kind of suggest that, but now we have to be much more strict, and we have to let them know that it is a good idea to stay at home. You must stay at home to ensure that not everyone else is going to get sick. And then finally, we'll look at implementing workplace controls. So first section, develop an infectious disease preparedness and response plan, and the purpose is to guide preventive actions. So what do? Well, number one, assign responsibility to someone in the organization to keep up with, to stay abreast of all of the guidance resources, and make sure that they modify all the plans, internal plans that are responsible for that. Call it your COVID-19 czar, if you will, but someone needs to have the have the responsibility of making sure that we're looking at all external information and new guidance. The plans that we develop should consider all levels of risk associated with specific work sites and the jobs. So we need to look at each job and what is their level of exposure. We don't want to come up with a blanket statement, a blanket policy, blanket procedures that says this applies to everyone. There are times when it's going to have to be different depending on the role, depending on the location that you are in the facility. The other things that we have to consider are non-occupational work risk factors, things outside of the workplace, things at home. Maybe they have sick relatives at home. Maybe they have to get to work, they have to be transported through a busy area, a typically busy area. Those have to be considered when we're adjusting our plans and developing our plans for individuals. Of course, workers' individual risk factors, we've heard many of those. Age, of course, underlying condition, of course. These are some of those underlying risk factors, and so those also have to be addressed during the planning phase. And then we'll have to make sure that we have factors to address to all those factors. So what OSHA came up with was an occupational risk pyramid for COVID-19 that you see in front of you. And basically there's 4 different levels: very high, high, medium, and low. Most of us are going to fit into that medium to low range. Very high is going to be for those people who produce or who are exposed to aerosol-inducing procedures, like a coughing-inducing procedure, some dental procedures, intubation, those types of things. So we know that that's a very limited set of people, and they're considered to be at that very high risk. The high risk, the next level down, is for healthcare workers or medical transport workers, some mortuary workers as well, where they're not exposed to the aerosol-producing processes, but they're exposed to the people who may have the virus or are suspected to have the virus. Medium and low, that's where most of us will fit in. If you're outside of the healthcare industry, medium is that you do have to work basically close by someone, perhaps within that 6-foot range. Or you've worked with someone, or you need to work with someone who's traveled to an infected region. So we would consider that person to be medium. And so the mitigations that we take to address those people might be different than those that we take for those who are at a low risk position. And the low risk, those are the ones that they do not require close contact. And so as such, they're at a lower risk. And so we can take that into consideration when considering what type of controls would be necessary. So we want to also make sure, each organization needs to make sure that they look at all contingencies. What are those contingency plans, including what happens if there's a lot more absenteeism? That's going to happen. What happens when someone's going to be infected? And they work with other people? What's going to happen with them? So our contingency plans needs to look at those scenarios: worst case, likely case, most likely case, and best case. Our contingency plans need to look at social distancing and staggered work shifts, and perhaps even downsizing operations, because priorities now have changed quite a bit, or changing priorities from one product line to another product line. But we have to consider all of these, and then how do we make sure? That we have this in place, and how do we make it effective? So on the right-hand side now, oftentimes you'll see the Kaizen perspective. So the Kaizen perspective says, in this case, there's a little bullet there that says visual standards and training, okay, which is addressing social distancing. So how do we do that? And we've seen many examples, and you'll see some more, but with regard to visual standards, we need to make social distancing very clear. What is the right distance? What is my area? What is my space? It needs to be a reminder. It needs to be mistake-proofed. Now, we can also look at different options for operating with a reduced workforce or a changed workforce. So in the bottom right-hand picture, you see an example there from Promega, and there's some examples of QA people and IT people and HR people who were probably working on projects before COVID-19, and those projects are now put on hold. They're a lower priority. So they might be available. And they were training, Promega was training different people outside of the normal workforce on things like kit packaging in this particular case, so that they can meet the production demands, the increased production demands. So this is all part of contingency planning. And then, of course, how do we address the problem of interrupted supply chains? That also has to be addressed during contingency planning as well. Here's some examples. I'm sure many of you have seen examples similar to this of social distancing at a deli. Very clear, 6 foot apart, stay away. The next one in the middle, dots representing where I should stand, and the third one on the lower right, kind of a zoned area of where I should be. I think that the first two work out much more effectively than the third one, because in that third one you can still be somewhat close to someone if you're in your square. So these are the types of things that are done, of course, in a store, but there's no reason why it can't be done in the office, and they are done in offices. And we should be making sure that we do that to encourage, to make sure that we all have it in mind of what is the proper social distance. Promega provided some examples also on social distancing. You see in the top left-hand corner some drop-off locations that they've identified since the COVID-19 virus became apparent. And so there's some examples there of what are some drop-off locations to make sure that we're not going into rooms that we don't have to go into, and we keep that distance apart from each other. On the right-hand side, you see some defined pathways to workplaces, and I know it's hard to see, but these are different. The different colors represent different types of or groups of people, and they have different ingress and egress and pathways in the workplace to make sure that there's less interaction between the different groups, so that if there is a case, we're not sending the entire facility back to their homes for quarantine. In the lower left-hand corner, they also provide us examples with Promega provided us with an example in how they alternated schedules, so that the different shifts have absolutely no interaction with each other, and they're not overlapping shifts anymore as they once were. So this is to make sure that, again, if there is a case that is found, a suspected case, that it's not going to affect all of the people. And this is extremely important because of what Promega is building for all of us, and helping society as a whole. So those are some examples. The next chapter of this OSHA guidance document has to do with implementing basic infection prevention measures. Prevention's key. Oh, first of all, you probably notice there's a whole bunch of tools on the right-hand side, the Kaizen perspective, and there is, and because there's a lot of opportunity here. So this is about implementing good hygiene and infection control processes. The guidance documents talks about promoting frequent and thorough hand washing, including places to wash hands and alcohol-based hand rubs containing at least 60% alcohol. So you see what I'm saying here? This is providing the what. This is a guidance document that says this is what you need to do. Places to wash hands. But what it really doesn't tell you is how much and where and what kind of locations and how do I replenish all of those things. And that's where the Kaizen perspective comes into play. We use our tools, we use our mindset, we use our principles, our knowledge to deploy this. So visual standards on what should be where, what should be located where. And also Kamishibai audits for best practices on perhaps washing hands. What are the best practices? And maybe also instituting an audit process so that we can verify and give feedback to people. In the past, we didn't do these things. It was like obtrusive. We didn't want to get in someone's space and talk about these types of things. But today it's more critical. It's our lives. It's our livelihoods that we're talking about. And so now we have to kind of change our course of mind, our mindset a bit, and think about doing things like this. If we have a standard in place, we need to make sure that standard's being followed. We need to make sure that if the standard is not being followed, that it's clear to everyone, that we can see it. And so we also want to talk about point of use, which is also part of the second S in 5 order, set in order, and making sure that all these things, the hand washing, the alcohol-based rubs, are at point of use. And point of use today means commonly touched surfaces by many people. That's point of use, and we should, anytime we have something, we should be that we're all going to touch, or there's an opportunity for many of us to touch. We should have those wipes right there. And then how do we replenish? We can replenish with a Kanban system for these hand sanitizers, for the disinfection wipes, and supermarkets, so that we pull from the supermarkets and we never run out of these items. And this provides a great system overall, a good, robust system, because I know we all know what happens, and we see this happening at the state level, where we start to hoard things. We're afraid we're going to run out of gloves or masks, and we don't trust the system, and so we start to hoard things. And if everyone's hoarding stuff, then we have too much, and it's all over the place, and it's out of control. So a good Kanban system in supermarkets and a water spider system to replenish all the different areas are things that we can put in place so that we don't hoard, and we have the proper amount, and we never run out. Another part of the guidance document says, encourage sick workers to stay home. Now, I know that sounds perhaps a little weak. It is a guidance document. Remember, there are no shalls. So you look at the standard or the guidance document and see what it says, but then you interpret your own way internally. So if you say keep sick workers at home, which I think most of you will be doing, then that's a policy. That's your policy. And things that we can do is to monitor workers upon arrival. That's a way to encourage sick people to stay at home. Let's monitor temperature when people arrive. That is a way to prevent the sick workers from entering the facility. Also encourage respiratory etiquette. I know it sounds basic. It's something we teach perhaps our kids, or we have taught our kids, but sometimes it's a habit and people don't sneeze the right way. And so we want to make this visible. If someone's not sneezing the right way, the question is, how do you make it visible? This is a principle of Kaizen, to make all problems visible. That's why we talk about visual management and visual standards. How do we do that in this particular case? What are the ways that we can make an improper sneeze or cough visible? So someone sneezes into their hands, or they sneeze out in the open. What can we do? Can you raise your hand? How do we do this in a way so that we all understand that we're not being offensive to anyone, but we all agree that there's a way to signal when something's not properly done? Because we need to do this. We need to make sure that we are preventing these types of things from happening. We want to encourage that respiratory etiquette. Providing tissues and trash receptacles. Of course, point of view storage at the frequently touched surfaces, that's all part of set and order as well. Okay, so I got a little picture here. It's in an office building. It just says what's wrong. That's a keypad to get into the door, and obviously there's no wipes there. So lots of people are going to be touching that. By the time one gets to his or her office in this office building, they may have touched their face multiple times. Here's another example in an office building. On the left-hand side, you might say this is kind of a visual standard. It looks nice. There's a picture. There are a lot of words, though. So what's bad about a lot of words? What's different? And we talked about one-point lessons. Pictures, easy to understand, not a lot of words. This one has too many words. Plus, it's in an office building, and they talk about what to do or how to wash your hands when you prepare food, or how to clean up after a child. This is probably not going to happen in an office. So it's a general document that someone decided to put up, and they can check it off the list, but it's not effective. It's not effective. This does nothing for anyone. Look at where it's hung. It's placed on the door. First of all, that's not safe. If someone was to read this, which I don't think they are, it's not at the point of use. It's not at the sink. And if you are going to read it on the way out, you can get bumped. Most likely, you're not going to read it there. So it's not effective. So this is where I'm saying that we have to use our Kaizen knowledge, our principles, our ideas to say, what makes sense? In the past, these types of things might have been placed or hung up by someone in the janitorial staff and HR and environmental or whatever, and that's all fine and good. But people with a lean mindset, a Kaizen mindset, should also be strongly involved in these things to make sure the deployment of these mitigation practices are effective. This is just some examples of some supermarkets, supermarkets that can be used for PPE or disinfectant wipes within the facility, so that we pull from a common source that's readily and easily able to be pulled. Continuing on with basic infection prevention measures, we want to also make sure that we're looking at flexible work sites, of course, telecommuting, and staggered shifts. And we need to make sure that we are setting those in order too. As part of 5S, we're setting in order. So we need to make sure that people working out of their homes have all the tools, the equipment, the hardware, the software that they need to do their job. And so this also becomes part of the deployment, the effective deployment of people working at home and telecommuting, and making sure that we still keep the concept of setting in order. Another really big thing is we need to start looking at discouraging people from sharing tools, equipment, laptops, computers, whatever it might be that can be shared, a printer, a copier, scanner. What can we do so that we discourage that? And that's also part of the set and order mindset. We also want to maintain regular housekeeping practices, including cleaning and disinfecting practices. What are those? How do we develop those? How do we deploy those? If we had some in the past, they need to be modified. I'm sure they need to be modified because of the stringent requirements that we now have that we may not have had before in the past. This is all part of, in the mindset of 5S, this is all part of SHINE. Shining our surfaces, our commonly shared surfaces, shining our hands, shining our face, standardizing, and recycling too as well, recycling of masks. Standardizing, what's the standardized process for doing so, for cleaning? And how do we make sure that we are doing that, we are adhering to that through audits, through Kamishibai audits and other forms of ensuring sustainment? Another part of standardizing and the guidance document says that we should be using EPA approved products for emerging viral pathogens. And so we want to standardize on those two as well. So here's some examples from Pomega. Point of use cleaning and sanitation supplies that are there. On the right-hand side, the picture on the right-hand side, a little bit hard to see, but you can kind of see on the top of the cabinet there, there's some labels beneath the Clorox, beneath the other cleaning solutions that basically is identifying what should be there. So if something's missing, it's obvious, and so that's what we need, and this is one of those locations. And if you had that water spider that's driving around the facility or walking around the facility once or twice or 3 times a day to replenish these materials, they know where it goes. They know where it belongs. Also, some nice visual instructions on how to use hand sanitizers. There's some instructions. So again, that's great, and that's a standardized process, and they've standardized that throughout the facility. The next part of that is to sustain. How do we make sure that we are doing that and people are doing that as well? All right, the third chapter is about prompt identification and isolation of sick people if it's appropriate. So what do we do? Well, first of all, this is really critical. I don't have to tell you that. It's extremely critical. A lot of organizations are coming up with ways to self-monitor, self-certify, completing a document, whether you're a visitor or an employee, periodically, every day, every other day, completing that document. And that document might ask a bunch of questions like, have you been sick in the last 24 hours or the last 5 days? Have you been in contact with someone who's traveled from overseas, et cetera, et cetera, et cetera. This is a way to help out, to make everyone aware. And this is a way to perhaps identify people who may be sick. Got to develop policies and procedures for employees to report symptoms. How do they do that? What's the best way? How is it non-threatening to them? How are we going to make sure that they're not going to get in trouble for doing this? And then what about when we do find someone who is ill or suspect to be ill? And they're in the facility? We need to have an isolation room. We should develop an isolation room, create an isolation room, and that entire isolation room can be 5S. It should be sorted, set in order, shined, standardized, and sustained. And so we do a full implementation for that isolation room. But that isolation room needs to have closable doors as part of the room and the guidance requirements. And then, of course, train employees who work in there or who might go in there to make sure that it meets the standard, the internal standard. So continuing on, we want to make sure we take steps to limit the spread of any kind of respiratory secretions from those who might have COVID-19. And so point of use storage for masks, respirators, face shields become extremely important. We need to make sure that we have those at the proper locations so that we limit that spread. Isolate suspected cases from the confirmed cases. This is more in the medical environment, and so that's applicable there. That's more at the high level or the very high risk level. We want to make sure that we're restricting people from entering isolation areas. A very bare bones minimum should be in the isolation areas, whoever that might be. There has to be someone there to maintain them, but we don't want that to be a high traffic area, of course. And then, of course, we need to protect those who do have repeated contact with a sick person, again, perhaps in the medical environment. The fourth chapter is about developing, implementing, communicating workplace flexibilities and protections. Once again, you see this in the guidance document that we want to encourage sick people to stay home. I think we want to probably go above and beyond that. Start looking at your sick leave policies. What did they say? Review them. Are they consistent with what we're hearing right now? And are people encouraged to go on sick leave if they are sick or if they have symptoms of being sick? Is it truly there? Are there any detriments or roadblocks to someone not proclaiming that they are? So look at those. And then also align with your temp services. If you're relying on temps, you don't know where they've worked most recently. And so there has to be upfront, open, and honest communication about who's worked where and what are the requirements when working with temp services, and to make sure that there's no punitive leave policies if someone does not show up. And then other simple things, like if you required, your company required a doctor's note if someone's sick, perhaps that's going to be waived. It says do not require a healthcare provider's note for sickness. We want to look at flexible policies to allow for people to stay at home with their sick family members. We want to make sure that all concerns, employees' concerns about pay, about safety, about health, about leave, that there's a way that they can voice those concerns. There's constant communication and updates that are occurring. We've got some good examples from Promega on that. That's upcoming. We're going to provide training and materials about business essential job functions and what is required from a hygiene standpoint and a PPE standpoint. So that training becomes really important. Could be using training within industry techniques. And then, of course, we want to work with our insurance companies so that we understand the latest information, the latest requirements from a medical care standpoint. These are some several examples from Promega. In the upper left-hand corner, you see their internal webpage, and you see another number of references to COVID-19 situation summary, their key points, CDC guidelines. This is all for their people to understand and have these resources available to them. In the upper right-hand corner, you have weekly email updates to provide information and communication information to all the employees so that they know what is the current situation. There's also connection and support tools. You have something that's really kind of cool here where you have an example of square breathing, how to breathe properly. So taking care of the people, because right now we are in high stress environment and people react to stress differently. And some people are going through a hard time with family members of their own, with friends, with themselves. And so offering them some advice and how to help them out. And on the very bottom there on the right side, there's meditations, guided meditations that one can chime into virtually and learn how to meditate properly. And there's gratitude, a lot more focus on gratitude. I know that we're doing this internally as well, where we're trying to express our gratitude to people because these are difficult times for everyone. The last chapter is implementing workplace controls. So ideally, of course, we want to remove the hazard. That's part of SOAR, 5S, right? And so much of what we've talked about up to this point is to remove the hazard, to make sure the hazard doesn't come into the building. But what if it does come in? Now we need to protect ourselves. And so we're assuming the hazard's there. So how do we protect ourselves internally? We do so in order of priority and effectiveness. Engineering controls first, then administrative controls, then safe work practices, then PPE. And more than likely, of course, we will use some combination of all of these. Now, these are examples that the guidance documents provides. That includes isolating employees from those hazards, wherever those hazards might be. So let's say that a case was found in the building and someone worked there and they only stayed there in that particular area. So those employees who worked in that particular area or had interaction with that area, maybe that's what we're looking at as far as isolating those employees in that particular area. This has to be addressed. This has to be thought of on how to do this effectively. Installing high efficiency air filters throughout the facility and making sure that they're always high efficiency air filters, making sure that they're properly maintained, and we're looking at those. And we can institute that through our total productive maintenance program, specifically our autonomous maintenance portion, so that everyone is involved in looking at filters and making sure that we're changing those out appropriately. We should be looking at increasing ventilation rates also to remove airborne particles. Installing physical barriers. We've seen a lot of those at grocery stores and other stores, but there's no reason why we can't do that in our own facilities as well. And many organizations are doing that within their manufacturing facilities, within their office facilities as well. Installing drive-through windows. In healthcare settings, we see these pop-up hospitals everywhere, and all these pop-up hospitals have some sort of negative pressure ventilation, so that we're again spewing out the airborne particles that we don't want in the facility. The idea of installing physical barriers is an example of Poka Yoke, or mistake proofing, so that if you have to be close to each other, if you're at a grocery store, you're buying stuff and you have to pay for food, that person who's working on the other side of the counter is less than 6 feet away from you. So how do we make sure that there are no aerosols? How do we do that? Well, we do that through mistake proofing with a physical barrier. And so we've seen examples like this, and there's a couple examples in front of you. Another workplace control, administrative controls. This includes looking at, reflecting on work policies and procedures. We talked about that. Of course, replacing any face-to-face meetings with virtual meetings wherever possible. I've seen and heard people do this in office settings where they're having virtual meetings with each other, even though they might be 2 or 3 cubicles away from each other. Still a good practice if for some reason you have to be in the facility. Alternating days and shifts, discontinuing non-essential travel. By the way, all of these things, if you look at the right-hand side, these face-to-face meetings and getting together with people for problem solving or whatever, can be handled with virtual huddle meetings as well, and virtual Gemba walks. Virtual Gemba walk, for those who don't know, our Gemba walk is, Gemba means the place where the action takes place, the place where value is added. And so we promote doing Gemba walks. We can do that virtually. We can watch someone walk through their process electronically and do a virtual Gemba walk with them, with the purpose of coaching that person and identifying waste and identifying improvement opportunities. These can all be done virtually very effectively. Developing emergency communication plans, like the examples that we saw from Promega, but also those plans can be communicated through virtual huddle meetings, which are very effective, and many of our clients are moving to virtual huddle meetings. We are doing the same. We have done the same, and they're very effective. Providing workers with up-to-date education on risk factors and protective barriers, and then proper training on protective clothing, how to wear it, how to use it, how to take it off. All of these things become really important, and we want to make sure that they're easy to understand, available for all. And this is where we can use a very robust training technique, like training within industry, to make sure that people do understand and they do follow the processes and the new standards accordingly. This is a TikTok video that I'll show you. I don't know if the volume will work. During rehearsal, it did not consistently work for some reason, but I can just briefly explain to you what this person is going to do is show you, you basically hear in the background the words nope and yep. So she'll do the wrong way and she'll do the right way. So first, she'll take off the glove on one hand and she'll pretend to do it the wrong way, and you'll hear nope, and then she'll do it the right hand. And then she'll take off the glove on the other hand, which is a completely different process, and you'll hear the wrong way, nope, and then the right way, yes, yep. Then she'll take off the mask and show how to do it the wrong way, and then how to do it the right way. And then she'll cough the wrong way, and then the right way. So hopefully you can hear this, but if not, I'll voice in and I'll play it twice. It's very short. It's a TikTok.
No. Yeah.
Okay, so I want you to, I'll play it one more time because it's very brief, but especially look at the gloves and the different process for taking off the gloves. This is why this is a kind of a skill or technique that if you just tell people how to do this, they're not going to do this consistently. It's not part of our behavior. We have to develop a new habit, and so we have to train people appropriately on things like this. So this time I will, just in case you can't hear anything, I will voice in the nope and the yep. Nope. Yep. Nope. Yep. Nope. Yep. Nope. Yep. That's it. Pretty exciting, but neat. And these are, oops. Almost got a third time. All right, so we'll move on. So these are great things to use, but again, we want this kind of information and knowledge to be a point of use too as well. With regard to safe work practices, we want to make sure that we include procedures for safe and proper duration, frequency, and intensity of exposure. If it was to happen, or if the potential of exposure is to happen, we're reducing the duration, frequency, and intensity, all of those. And all three of those words might have different actions. So you don't want to just like group them together, but think about how do we limit duration, how do we limit frequency, and how do we limit intensity? Now, some of the resources, of course, that will help this are tissues, no touch trash cans, hand soap, hand rubs, disinfectants, disposable towels, all of these. And we should be using the Kaizen perspective to make it effective. Set and order of point of use storage, Kanban system, supermarket, and water spiders so that we replenish and we never run out of any of these items which are so critical today. We need to require regular hand washing, including after PPE removal, which sometimes we kind of forget about. That could be part of a visual standard. And we could also look at how to sustain that once again through audits, an audit process. So once we have a standard developed, we can audit that process and provide feedback to people so that we can improve and we all get better. PPE. Well, first of all, check OSHA and CDC websites regularly for updates and make sure someone has that responsibility to do so. All types of PPE must be, of course, selected based upon the hazard to the worker. So that pyramid that we talked in the very beginning. It needs to be properly fitted and periodically refitted as applicable. A lot of times we have some poorly made masks or they're not the appropriate mask and you see people constantly moving them up. Every time we move them up and we change them, it does no good. We're defeating the purpose. So what can we do? How can we create some nice little one-point lessons, visual one-point lessons and standards to see that, to make it more obvious? They must be consistently and properly worn. We want to make sure that they're regularly inspected, maintained, and replaced. And we can institute our total productive maintenance process in that capacity to ensure that that happens. And also the proper removal and cleaning and storing and disposing, and to make sure it's proper, perhaps instituting Kamishibai audits. The next bullet talks about aerosol generating procedures, and there's a large section in the OSHA guidance document on the use of respirators, specifically N95 respirators and any other types of backups that we can use if we don't have N95s. I would encourage you, if you're in that industry, to go ahead and read the OSHA standard. And then there's also the process of training on respirators, how to put it on, how to take it off, how to dispose, how to inspect, how to maintain. And some of these respirators can be complex devices. And so that could also be part of our training within industry training process, as well as total productive maintenance. One last example of a person using PPE, additional PPE that 4 months ago, this person would have never been dressed like this. So these are the tools that we can use, and we suggest that we do use this to not just comply with the OSHA guidelines, but to make it effective. Many of you have the knowledge, you have the experience, you have the expertise. If not, you can gain it easily. We can help you out with that as well. But it's time to make sure it's so critical in today's world that we deploy these requirements, these guidance documents, and mitigate any risks possible. And we can do so through the use of our Kaizen tools. So with that said, I wish everyone every day, everywhere, to be well, to stay safe. We are thinking of you at the Kaizen Institute. We are going through the same thing. We understand it's difficult, and hopefully this will help, and we can all get through this together safely and soundly, and get our organizations back up and running sometime safely and soundly in the future. We do have additional webinars and online training classes that we are planning. You will be receiving emails on this and some invites on these. Doing virtual Gemba walks from home is a webinar that we're actually doing next Tuesday. Online daily Kaizen, sustaining lean improvements, zero defects journey, electronic 5S, many different types of topics in the lean world, in the Kaizen world, and also interviewing. We like to interview people, clients and so forth, on what they've done with regard to lean and Kaizen practices, and or anything related to COVID-19 as well. Good practices, best practices. So our contact information is here. And we encourage you to contact us if you have any questions. Chuck already talked about the availability of the recording. We are offering online training, webinars, online Kaizen events. Everything that we talked about here today can be treated as an entire Kaizen event because there's so much to be done. And of course, I know many of you have already started this, but there's so much more ways to improve what you've already done. Online coaching, customization of any of our materials, our class, our transformation practices, our project Kaizens, our breakthrough Kaizens, and there are additional sponsorship opportunities. So Promega is our sponsor today. Others can be sponsors. Please reach out to us about sponsorship opportunities coming up in the near future, and we'd love to talk to you about it. But once again, I want to thank you to our sponsor, Promega. Let me leave you with a couple of options if you wish. Number one, we can take Q&A. I believe Brady and Suzanne are online from Promega, and they said that they would entertain any questions about what they have done. Brady, can you just unmute yourself and just confirm that you are here?
Hi, Mike. Yes, absolutely.
Okay.
I'm here, and if anybody has any questions on what we've implemented, I'd be happy to talk to those, as well as some sharing in what we are planning on doing too. As Mike alluded, that we're always looking to improve here as well.
Thank you, Brady. And so I'm going to turn it over to Chuck so he can kind of coordinate this. There is any Q&A, any questions that may have come in through chat or questions for Brady and Promega. Also, as another option, this just came up, and of course, if you don't wish to stay, please, you can get off. I understand that. But I have a 4-minute video on that we just received a couple hours ago from Nestle and what they're doing to protect their environment from COVID-19. So all the things that we just talked about, many of them at least, in video form, and I can show that after the Q&A and any questions for Promega. So Chuck, with that said, I'll turn it over to you.
Thanks, Mike. Good job on that. And thanks, Brady and Promega, for being available for questions. If anyone has questions out there about any of the material that Mike has covered with us over the last hour, or questions for Promega about what they have done in dealing with the crisis, now would be the time. Feel free to unmute yourself and go ahead and ask a question. An alternative is also to write your question in the meeting chat. I didn't get any during the meeting, but if you wanted to write one in now, that would be the time to do it as well. So go ahead. Are there any questions out there?
Yeah, good evening.
Go ahead.
Yeah, ISO 47000, how do we club these two things together? OSHA 3990, can this be a subset of the bigger framework, which is ISO 47001?
I don't think that I could answer with regard to ISO 47001. I'm familiar with the ISO 14001, but I've always been a huge proponent in merging systems, integrating systems, and eliminating waste in duplicate systems. And this webinar today was an example of that, where we have a guidance document, but then we have really good techniques and ways to promote that and to do it the right way and to merge those. So I'm always a big proponent. I'm sure that there's duplicative requirements in this standard as well as the other standard you're referring to. And all I would do is just do what I do and look at the requirements and look where there's overlap and merge the two.
Thank you very much. Thank you very much.
You're welcome.
Thank you, Faisal. Is there any other questions out there?
And any questions from Promega too as well.
I have one here that for you, Mike.
Okay.
So you on slide number 50, you listed various Kaizen tools. What is the one tool that you'd focus on first if organizations wanted to use Kaizen tools to help with the prepare with the COVID-19? What would you do first?
That's yes, I would. If we looked at this, all of these tools are effective and useful. I would say that what you're going to get the biggest bang for the buck, and you can get many people involved in doing this, is focus in on the 5S tool, which does include, of course, point of view storage, as it says, is part of set and order. But also it kind of includes 1-point lessons, because the 4th S in 5S is standardized. And examples of standards are standard work and 1-point lessons, very simple, easy to read and understand 1-point lessons. I would primarily focus in on those areas initially, because you can get a lot of people trained up and deployed correctly. But we have to remember that this is not just simple 5S. This is 5S on steroids, if you will. It's taking it to the nth degree and really understand what is the true essence behind 5S and how can we use this effectively to protect all of our people, not just about housekeeping, going above and beyond that. And I would start there. Then after that, I would be looking at, it's kind of almost in order, what you see there. It's on this page, starting at the top and almost working your way down.
Thanks, Mike. Are there any other questions out there, folks? Either for Mike or for Brady from Promega?
Okay. Well, I can show this video, Chuck, if people would
Go
like
ahead.
to stick on. It's a little bit over 4 minutes long, and then we'll break after that. And if for some reason there's no sound, it's just music in the background, so you're not really missing anything, but you'll see some really nice examples. That's it. Thank you.
Okay, thanks, folks. Unless there are more questions out there, that'll wrap up this presentation. We hope to see you again next week when we talk about online daily Kaizen and virtual Gemba walks. Thanks and have a great day.
Thank you.
Thank you.
Thank you.
Thank you.